Let me see if I can share some information. Share the information I pulled. And maybe going over. Change that. Going over some things that I found when it comes to home care, home health care, Medicare Advantage, big old beautiful bill or OBBB. And I feel like this will help you to have a wake up call as well as not have such a knee jerk response. So, this is a message designed to wake you up and to get you to look for a pivot for your home care agency. All right, so make sure I put that in the comments. Home care, home health care, Medicare Advantage. If somebody can write it for me on the other platforms, going one by one, and one big, beautiful bill. Okay, I'm gonna make sure I pin that. Okay, one big, beautiful bill. Okay, beautiful. Take it up. Home care. This is for all of us in the community. Home health care. And usually I don't get on to all of the platforms. I'm on to Instagram here, I'm on TikTok here, and I'm on Facebook and YouTube here. Home health care, Medicare Advantage, and one big beautiful. I know some of you have been waiting for me to share on this, but honestly, this is something that, you know, I want to make sure I'm giving you the most accurate information before we dive into it. Here, put it on YouTube. So while I'm doing this last platform, please let me know where you're watching me from. Please let me know where you're watching from. Yeah, that's something. Health care, Medicare, Advantage, and the one with okay. All right. So, one thing for sure, uh, some states will be more affected by this than others. Some states are going to definitely be more affected by this than others. And it's still way too early for us to know the effects because some of these effects actually are not, going to take place right away. It's for their, some reports and reputable sites are saying 20 to 2027. Some are saying 2028. And but if you are if you are an existing home care business owner, give me the number one. If you're an existing home care business owner, give me the number one. I need you to listen up because this is a wake up call if you're an existing home care business owner. And I don't have too much time to talk. So I want you guys to, your existing home care business owner, give me the number one. And let me stop the screen share. It's telling me to do that. let me come here first. So, for those of you who are joining me for the first time, my name is Sean, aka the Savvy Business Chick, and I am a mentor to people who want to start. Oh, thank you so much. Look, I never have to ask TikTok to give me hearts. That's why I love you guys. I got some special people. I never have to ask TikTok to give me hearts. You guys just automatically come with it. So appreciate it. So for those of you who are on the other platforms, hearts are welcome and they're free. So my name is Sean. I am the original home health care business mentor. And because the home health care industry is a very tight-lipped industry, I like to be the one who opens up the doors because it's a lot of gatekeeping here, right? And one of the reasons why I have been waiting to share initially on the OBBB, One Big Beautiful Bill, is that like it's just literally something that is a lot to unpack. It's just a lot to unpack in this One Big Beautiful Bill. And last night I got a question. I did a live last night on TikTok, YouTube, and Facebook. I got a question on TikTok and I answered it based upon some factual things that I found and talking to some home health agencies. So, a home health agency in this example is a Medicare certified agency. And so I explained how we have home health agencies, HHA, then we have home healthcare agencies, which are skilled nursing agencies that are not Medicare certified. And then we have our home care agencies that are non-skilled personal care, ADLs, and then the last level in some states are homemaker companions, like a Connecticut or Florida, right? So those are the 4 levels, right? And one of the things I said is that home health agencies are going to be able to have an advantage, especially for the rural areas that they keep talking about. If you've been hearing that it's going to affect the rural areas, like closing of rural hospitals, blah, 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 blah. Have you heard? If you've heard that, let me know to say why I've heard that and I haven't heard that. If you've heard that it's going to affect, there's going to be major closings in these rural areas, give me the why for yes and for no. I want to see how many people are following. Thank you so much, Nash Braids, for okay. All right. Why for yes and for no. If you've heard that it's going to affect, they're going to be mass closings, right? I've even seen on TikTok, I just heard that the hospital I work for is going to get closed, right? And particularly in the rural areas, here's something that's going on that is getting prepared for the silver tsunami I told you guys about in the first place. Are you guys following up? Are you following me? Are you following me? So with the home health, with the rural areas, the home health agencies are really going to be able to take advantage of any of those hospitals that are closing. Why? Because there has been a rise of telemedicine, telehealth. If you haven't noticed that, there has been a rise of telehealth. It really started around COVID. Hey, Tammy, how are you? Hey, Tammy, how are you? Tammy, is your when is your nurse boss summit? Because I lost my other account got hacked. All right, guys. That is, I am Tammy Lewis, who is the founder of the Nurse Boss Summit. And this year, I believe, it's in North Carolina, where she first started a home care business. So with the rise of the okay, it's August 14th through the 16th. Okay, I'll definitely be sure to share it on my new page. August 14th through 16th. Definitely. Oh, you have a complimentary ticket for me? Okay. All right. All right. I'll message you after this. Um, Absolutely. I will message you after this. Oh, okay, guys. So, to make sure, I got a little commercial break, but it was definitely, I'm glad you found me. With the home health agencies, you're going to be able to take advantage if you position yourself. Okay, you started house calls in Raleigh. Oh, and you have 112 clients. Wow, that's good. I'm gonna pin that comment real quick. All right, guys. On Instagram, I am Tammy Lewis. I believe it was 2 years ago. I did the Nurse Boss Summit. Um, uh, my award. Um, the Tammy, they gave me this great, amazing award on being a nurse mentor, and I said, wow, what a privilege to be labeled a nurse mentor when I'm not even a nurse, but I have mentored so many nurses, from nurse practitioners, registered nurses, LPNs and LVNs, and certified nursing assistants. So what a privilege. So thank you so much, Tammy, for the complimentary ticket. And August is my month, so I definitely make, yeah, and North Carolina is not that far away. So, but guys, we're just talking about telehealth. And Tammy just said she started doing house calls in Raleigh. And she has, look, she started in May of 20, May, like 2 months ago. May 22nd, and she's already up to 112 clients. Tammy, are you available? I would love to hear. I would love to hear how that's going. This is a total diversion, but this is very, very interesting to me to hear, because I need you guys, part of this pivot is that I need you guys to pay attention to the trends and not get so scared. This is a time to pivot, not a time to get scared. It's a time to pivot, not a time to get scared. And this is a wake up call to all of you who are Medicaid heavy. That's the first thing I wanted to tell you. Right, you can write that in the comments. It's a wake up call. Okay, great. All right. Hi. I was just took a chance. I said, I didn't know if you were dressed. I said, okay, so you guys have to listen in. Huh?
I'm sitting over here working.
Okay, so how did that happen where you just started doing house calls?
Actually, I have a friend who is a nurse practitioner, and I've been wanting to do this for a while, but as you know, you have to be a nurse practitioner to do primary care.
Mm-hmm.
So we sat down, we had a conversation, and I asked her about, partnering, and she agreed. And it was so funny because one of her friends had three care homes.
Mm.
So, yeah, and she was looking for primary care within the care homes.
Mm-hmm.
And we signed up with her. She had three full homes. She now has four. She said purchased a fourth one. But she told someone else who had care homes. They told someone else, and it just really caught on like wildfire.
Mm-hmm.
And then before I knew it, we had geriatric care managers approaching us
Mm-hmm.
about seeing their patients. And we recently had to turn away a facility with 200 plus beds. And there was another care home franchise that had over 150 patients that we had to care on, turn away. But the need is there.
The need is there, and so little backstory, that Tammy is a nurse. She started a non-medical home care agency in North Carolina many moons ago, many decades ago. had a profitable exit, because sometimes people don't understand that you can have an unprofitable exit, meaning you were not doing well at all and your business just closed because you never really caught on to getting clients. You just struggle. You just struggle, so your business closed. So having a profitable exit, meaning somebody saw her business, said, hey, I want to buy this. And, she was ready to take a break, because, not all business means I got to work it for the rest of my life. Some people start businesses to sell. So she was able to do that. And, she has a story to share about her late husband. And then she is the founder of the Nurse Boss Summit. And this gives nurses entrepreneurial opportunities. And I'll just leave it like that. So now she's entering in. Is this the fourth year for the?
The fourth year.
This is the fourth year for her Nurse Boss Summit. It's like sponsored by nurses.com. Like that was one of the things that amazed me. I was like, nurse.com. It's sponsored by nurse.com. You have high representation. But now, just as entrepreneurs do, you know what? Maybe I'll get back into the groove again. So this is what you're saying. You're getting back into the groove.
I get back into the groove of things. Mm-hmm. Of course, my husband, I kind of took a step back from everything. Mm-hmm. That's been more than 3 years ago. I actually started a foundation in Arlington, mm-hmm. The Anthony Lewis Foundation for Brain Tumors. And it's a nonprofit, and we help individuals who have brain tumor diagnoses. So actually at the Nurse Boss Summer, the gala where you receive your award, mm-hmm. all the fees from the gala, it goes to the foundation.
Absolutely. Now, with what you're doing now, picking up house calls, do you believe, and guys, we didn't plan this, because as you can see, if you're on Instagram, she's like, I just found you. I'm asking, this is like a live interview, that a home care agency can add the service of what you're doing to their service model.
Absolutely. And, that's kind of where I got the idea, because what happened was, before I exited, I partnered with an MD and an MP, because I had so many clients who lived at home, but maybe their families worked or they lived out of town. Mm-hmm. They couldn't get to the appointments. So, we partnered with them, and they started seeing our patients inside of the home. So that's kind of what gave me this idea. I'm like, I can do this myself.
Mm-hmm. Right.
Because that wasn't profitable for me. It was just an added service for the clients.
Right.
Of course. So that made us kind of stand out from some of the other home care agencies.
Absolutely. And so, still dissecting a lot with this OBBB, One Big Beautiful Bill. The pathway has already been set. In my opinion, there's still a lot to learn. That prior to this, telehealth started to be on the rise because of COVID.
During COVID, absolutely. But it's very profitable now, and it's definitely caught on a lot. And I think people really got accustomed to staying at home and visiting the doctor from the comfort of their own homes. Not only that, nurses and nurse practitioners did too.
Yeah.
So,
I wanted to show people that who I was really talking to on TikTok, because I'm on TikTok and I'm also on YouTube. So they're just listening to you. But yeah, that's good, and that's what we have to do, because how long did you have your home care agency? I forgot.
Years.
Just
shy of 10 years.
Okay.
Yeah.
And so how many times did things change within those 10 years?
Oh my God. Seems like they're changing all the time, the rules, regulations. But not only that, I think people feel like when they see you, it looks glamorous. Mm-hmm. Oh my God, I want to do this. but you don't know what you don't know until you actually start your own business.
Yeah.
And I think one of the biggest challenges for me, it wasn't actually getting clients, because I got the clients, and my clients were private pay, predominantly private pay.
Say that again, because people think this is like the Wizard of Oz. Like, they think private pay clients are like the. And your first agency was in Raleigh. I can't remember.
Yes, it was in Raleigh. It was in Raleigh. I literally had one Medicaid client, and I'm going to tell you, I wasn't even doing Medicaid. I took the Medicaid client because I was trying to get a contract with the VA, and the VA required you to have a Medicaid contract. So the Medicaid the Medicaid certification, I took 3 Medicaid clients. Of course, two passed away, and I kept the one, but I never took any more. But I had like 62 VA clients on that, and everybody else was private pay, and I had over 300 clients. So it's not hard getting the clients if you do the work.
Yep.
You can get the clients. And a lot of times, of course, at first you have to get out there, build the relationships.
It's a relationship building industry. Yes.
A lot of people think you can go. It's like, I went over here. Where are you getting your clients? Because I went over to this facility and I dropped off my information. But did you ever go back?
Exactly.
No. And they feel like, well, I gave them my information and they never sent me any clients.
Exactly.
And in this industry, it's relationship building. And it's like, I scratch your back, you scratch mine. But after a while, the last 5 years, I didn't, well, I'll say 4.5, I didn't even market anymore. Because I knew who I was. We did great work. Money talks to money. So, if you're doing a good job, they're going to tell their friends. Again, the biggest problem that I had was just, the finding great caregivers.
Yeah, finding great caregivers, right? And because it literally went from a nursing shortage to a caregiver shortage.
Exactly.
Yeah, but not impossible. Like, it's hard, but not impossible.
Impossible. You just really got to just weed everybody out. Just weed them out. And you can bring someone in and they can interview well, have a clean background and clean drug screen. They don't work out. They're no call, no show, or, they're not conducive to what you're trying to do. So it's just weeding through.
A lot of people, ask me questions about starting their home care business, growing their home care business. I found that I didn't really have a lot of issues year 1, year 2, year 3, but maybe it was like a random year, like year 4 or year 6, that not that's where I found out, because I was growing so fast, that like if your infrastructure doesn't catch up to how fast you're growing, then like you said, you got 300 clients, but then you have a consistent caregiver. I mean, sometimes you have caregivers, they don't tell you they graduating nursing school and they're not available anymore because they don't want to be CNAs anymore.
Exactly. And they don't tell you because they think they're not going to have a job.
Right.
They come in, they know that they have 3 months left, but they need the money. So they and actually those make the best caregivers. And that was what I started to do, was partner with the nursing schools. Carolina. So a lot of my aides came from North Carolina Central.
Okay. Yep. Yeah, we got we had from the communities colleges. We got some of our nurses from the community colleges. But as a non-medical home care agency, you're able to train a lot of your caregivers. So starting with a skilled agency, they have to already have the experience and enough to be left independent in a home setting. So I'm excited to hear that. Can since this has been a great diversion, can you tell us what to expect with the Nurse Boss Summit this year? What's going on? What's the theme? and your heart of why you started it?
Actually, why I started it, I really feel like that God just dropped this, in my spirit, because once I sold the home care agency, people started asking me to help them to start theirs. And I had so many requests that I actually wrote a book on how to start a home care agency, thinking that maybe, I'll just direct them towards the book. But then they would read the book and come back and it's like, well, I want to start a care home, or I want to start a CNA school.
Right.
Like, well, I don't know how to do that, but you know what? I have super friends who know how to do that. So at first I was kind of referring them out to different people, which I still do. But then I'm like, why not just put everybody in the same place and let them at one time? So that was kind of how the Nurse Boss Summit was born. And this year we are in North Carolina. It is here. I'm really excited. Trinity Whiteside is going to be there. He's a native, and he's really near and dear to the nursing industry. A lot of people may know him from Tyler Perry's Sisters or Zatima.
Okay.
Here, but I'm really excited. One of our speakers is going to teach us how to do chronic care management.
Oh, that's good.
So I am like super excited about that. So yeah, but we have a lot of different nurses and entrepreneurs who are going to be in the building this year, just really teaching us how to start our businesses, grow our businesses, and scale. So yeah.
And this is essential, really, really good if you are a nurse entrepreneur, because with Tammy's, she offers CEUs.
Yes.
You offer CEUs. How many CEUs were people, like if they attended the whole time, could they anticipate getting?
Yeah, the CEUs, I give enough CEUs is 24, so it's enough to cover both years.
Okay, great.
All we need is 24, so we have enough to cover, both years. And CNAs are welcome to come. You don't have to be a nurse. You can come. We have days in the building this year. One young lady has a scrub line, and she's coming to see how to scale her business and grow it. So, yeah, and she's a CNA, so that's exciting. And there's another CNA that's coming that has a home care agency. So, yeah, that'll be, we're healthcare bound, healthcare professionals, not just nurses.
Excellent. Well, like I said, I appreciate you interrupting and giving us a good commercial break. But yeah, my account got hacked about in March, and I just decided not to pay the hacker in Bitcoin, so which is what he wanted, and because after it just settled in, I said, well, thankfully, I don't just market on one platform. I was, got heavy on TikTok, heavy on YouTube. And then I actually have my page back, but without any of my followers. So I had started the home care mentor page, because it was available. And I said, wow, that's what I call myself. I call myself a mentor. It was available. And so I've spent more time growing that, because that's what I opened up in March. And now that I just got the name back for Savvy Business Chick, I'll be building that up. But you can't go live until you I think get to like over 100 followers. So but with that being said, I will definitely share it on my page. I'm doing something this year for the first time as well, and I definitely might be inviting you to speak, because I really feel like we in the home care industry need people to open the gates, because this is a lot of gatekeeping in our industry.
And that was another reason why I wrote the book. I sat down on a Saturday and I'm just gonna make an outline and just I looked at I started at 9 a.m. I looked up, it's like 1:30 in the morning, and I had completed the book. But I wrote it like a tell-all. I'm like, I'm just going to tell everything I can think of, because I had such a hard time breaking into the industry because people didn't want to share.
And you would think you would know know stuff because you are a nurse and you worked in the profession, but when you come to the business side, there's just so many layers. There's just so many layers to, yeah. So
Yeah.
hopefully, for those of you who have been listening, if you're on YouTube or Facebook, or watching on Instagram and a little bit on TikTok, your takeaway is that the business is out there. So don't let them lie to you in these Facebook groups that it's hard to get clients.
It is not.
It's not hard to get clients.
To reach out to me, I'll definitely be available after the summit.
Okay, yeah. Okay, all right, yeah. I'll definitely do that because I wanted us to do a little bit more formal interview on YouTube anyway. Like I said, getting the backstory, and now even more basis because I'll end with this, guys, and then I'll restart because I have a class tonight, so I don't want to keep you guys too long for lunch, but this at least covers one of my bullet points. Have a pivot, have a plan for this, how the one big beautiful bill is going to affect home care and home health care. Right now, most of you are scared because you keep hearing the headlines, Medicaid cuts, Medicaid cuts, Medicaid cuts. And this should be a wake-up call to you that you are too Medicaid heavy. You have too many eggs in your Medicaid basket. Yeah. You need to have a diversity. And I'll be coming on here later to talk to a little bit more about Medicare Advantage, which is one position you can take. And then you definitely need to rev up your private pay marketing. As Tammy said, she had about 68 VA clients, and the rest of that 300 was private pay in North Carolina.
In North
Carolina. So.
And the saturated, but the business is still there. Because there are a lot of agencies, but there are not a lot of good agencies.
Absolutely. There's a lot of agencies, guys. You heard that, but not a lot of good agencies. And that's why people would transfer to us from other agencies.
Exactly.
Yeah, that's why they would transfer. So, so two things before we go off. You can either follow I am Tammy on Tammy Lewis. I am Tammy Lewis on Instagram, or you can go to follow Nurse Boss Summit on Instagram. She has a upcoming Nurse Boss Summit that's coming up in August, about 3 weeks away.
It's 3 weeks away. And if you could just mention that you heard me here, I'll inbox you a discount link. How about that?
Oh, that's great. Thank you so much for it should give you a discount link because you need to get in the rooms where the information are being shared. It's only been so much free information we can share with you on live, right? It's in the rooms where we break things down.
Exactly.
Okay. All right. So I'm gonna reset, guys, and get lunch. I gotta send my husband off, and then I will. If you don't have the notifications turned on, I might get back on here at 2. But I definitely want to close us out for what I had to share about the one big beautiful bill. All right. Take care, and thanks so much, Sammy.
Oh, thank you for having me.
Okay.
Thanks.
Right. Bye. Sorry on TikTok and YouTube and Facebook that you could not see who I was talking to, but I felt like that was just a great segue into what I wanted to share, and that just really proves that when God said go up there and talk, because she was following my other account that had like over 25,000 followers, she had just found me. And I just want to encourage you today that the clients are out there. The clients are out there, and I'm constantly telling you, stay out of those Facebook groups, guys, because those Facebook groups are discouraging you. They're telling you that there's no clients out there. And if you've heard anything today, that I want you to note that in North Carolina, she said where they say it's saturated. Yes. So you got to be very careful listening to those terms. It's saturated. It's saturated. It's saturated. It's competitive. There's competition out there. And that's why you need to have a real marketing strategy. You got to have a real marketing plan. So when you go out there, you get noticed. You get calls back. You get people who send you referrals. Within 4 or 5 weeks, I have 3 people in my home care business summer school that have been doing the work. One in South Carolina, one in Florida, and one in Indiana. Every week, they're getting the results from doctors' offices to senior communities. And you know what? I said this before we even had the business summer school. I said, I'm doing this. I'm not making it expensive. I think to join was like $699. I said, because I want to help people who are struggling at the beginning of the year. And honestly, if I can be honest with you guys, 15 people signed up. And I know there's more than 15 people that are struggling with their business, but 15 people said, not today. I'll do that tomorrow. I'll focus on my business tomorrow. I'll play now, work later. And now these people soaring. These are private pay client referrals that they're getting. Private pay client referrals they're getting. So hopefully you won't ignore the next opportunity that comes your way. And we have the home care intensive that I have planned. I just announced for the month of October. Right now, it's at a discount. It's on sale. You can get yourself in a room with people who are going to tell you how to be Medicare certified, who are going to help you understand the certificate of need process, who are going to show you how to do your client admissions and assessments so that you don't submit claims that get sent back because you're not really showing the need of the client who has who needs your services. And then of course I'm going to do my marketing intensive. It's going to carry you through fall, the holidays, and the wintertime. Get yourself in a room if you're trying to start up or stack up. Send me an email at mentor@savvybusinesschick.com and say, Sean, send me the link. I want to sign up. Or don't. But I'll be back on to talk to you. Give me like an hour. I'm going to talk to you, and I'll leave it up about home care, home health care, the big beautiful bill, and Medicare Advantage. How if you use those, if you're a home care or home health care agency, if you pivot to Medicare Advantage, I won't even tell you think private pay is too much out of your reach. So I'll give you something that seems a little bit more logical to your mind. Medicare Advantage. That is your pivot. That is your pivot right now. And so I want to encourage you to get credentialed. Get credentialed in those right now. Yeah, please email me. And my husband's about to go to work, so I do have to get off. Make sure he has everything. I'll be back on here in an hour. It's 1:13 EST. I'll be back on here at 2:15 EST. See you soon. I'll post it, Tiffany.